Hi, I'm Dr. Power from PowerMD, located just north of the Golden Gate Bridge from San Francisco. I'm here with the patient today and I'm going to demonstrate a technique that's going to lift the cheeks, give some cheek definition, and narrow the face. The overall goal, typically when we're doing some structuring and sculpting of the face, is to try to achieve the perfect oval. And we want the widest point to be across the cheekbones. We do have that here in this young patient with beautiful bone structure, but the jawline is matching the cheek width. And typically what we want is we want the cheekbone, the width from cheekbone to cheekbone to be a little wider than the width from cheek to cheek. So a woman's face will be oval with the greatest width across the cheekbones. A man's face will be a little bit more rectangular with the cheekbones and the jawbone being at equal width. So in this case, we want to sort of feminize by sharpening up and expanding the cheekbone width and diminishing the width across the cheek or the jawbone, and that will give a nice oval shape. So that will give this patient a look that many of us will achieve with filters. If you look at what a filter will do to feminize a face, you'll see that the chin tends to be pointed down, the jaw is slimmed, and the cheekbones are sort of popped up. So we'll get a little bit of filler along the cheekbones right here in the middle cheek as well in order to give good lift through here. Definition, we're going to use a neuro relaxer to soften the jaw, and that's going to slim down here. We're going to use a little Kybella to remove a little bit of the excess fat tissue here and under here, and then we're going to use a little bit of filler to point the chin down. Again, everything is aiming to creating that nice, perfectly oval shape. The first thing that we're going to do is we're going to enhance the cheekbones and the middle cheek area. I always like to fill the mid cheek because that is the first area we all lose volume. So in our 20s, we're losing volume right here in the mid cheek. That's going to create a shadow here and sometimes a shadow here. She doesn't have that much loss because of her young age, but you can see a little flattening right here, and that's what we're going to correct on both sides. So you can see you get a little bit more cheekbone up here. That's going to make your face look slimmer. Already this jaw looks smaller than the one on the other side, and that is purely because we've enhanced the cheekbone. Got a little bit extra right here in the mid cheek. It does not crowd up on the eye because we placed this product deep. It doesn't move when you smile and crowd the eye. That's a mistake we see with some filler. It's placed too superficially. It moves with the cheek in a way that looks unnatural. In this case, it looks very natural and gives the face nice shape and definition. So let's take a look straight on. Take a look here, and so you see that enhancement here. All right, we'll work on the other side. They're pretty tolerable, especially once you take a look in the mirror and you see the benefit. Then most people are willing to tolerate this fairly minor procedure. So what we're going to do is point the chin down. That's going to be part of creating that perfect V-line in her face. So I'm going to come in here and get underneath the muscle. This muscle is called the mentalis muscle. All right, that one's a little spicy, huh? And we get up underneath the muscle, we can actually push the muscle down and forward. Good. Luckily, these chin injections last for a good year because they're not the least painful of all the injections you've ever gotten, huh? Now next we are going to inject a little bit of Dysport into the masseter muscles. The masseter muscles are the two muscles on the sides of the jaw that clench the teeth. These muscles can cause headaches, they can cause TMJ. Go ahead and clench for me. So that's the muscle right here. It's a big muscle here. I'm going to use a neuro relaxer. This is an injectable product that, a little pinch here, that will relax the muscle and keep the muscle from clenching so much. So when we do that, that's going to narrow out the jaw right here. And she's going to have a more narrow shape. So we've already achieved some nice strong cheekbones and pointed down the chin. We did that with Radiesse. This is a filler. The results are immediate and actually a little bit swollen right now, so she's getting a little bit of swelling now. But the Radiesse gave us some nice cheekbones and chin. Our next step is to use some Kybella. Kybella is going to remove some of these fat pads, actually dissolve the fat. Now this is a permanent result. So we don't want to overdo it, particularly on the face of somebody who's particularly young, who's young, because we don't want the face to look gaunt as the years go by and that natural volume is lost. And last but not least, we're going to use a little Dysport. This is a neuro relaxer. This is going to soften muscle contraction. We're going to use this the Dysport right here in the masseters, or these jaw muscles, and again, that's going to smooth out the face. So finish up over on this side, and again, check back with us in about 2 weeks to get another update on how she's looking, and again, the final will be at about 6 weeks or 2 months, so go ahead and follow along.